Hello? Can everyone hear me? We're good? Okay. Kind of want to keep track of my time as well, so. Hello, everyone, and thank you all for joining us today. My name is Maria Carello, and I'm a part of the 2013 full-time MPH cohort. My practicum focused on promoting positive mental health in the school setting using a very well-known holistic model referred to as comprehensive school health. My practicum took place with the Greater Victoria School District Student Services Department under the supervision of Deb Witten and Marnice Jones, who I very much would like to thank for making the experience so rewarding and enjoyable. I would also like to thank Dr. Catherine Worthington and Victoria Barr, especially with the numerous emails and allowing me to go third. I would also like to thank Betty Taylor, the School District 61 Student Services Department, members of the School District 61 Healthy Schools teams, and MPH colleagues. And in case you don't know, School District 61 is the Greater Victoria School District. I don't want to confuse anyone on that one right off the bat. I wanted to highlight this Joint Consortium for School Health document because it is becoming widely known in the school community, providing an in-depth description of better practice approaches to promote positive mental health using a comprehensive school health model. And for those of you interested in comprehensive school health and mental health promotion, you could access this very easily on the Joint Consortium for School Health website. For my Culminating Project, I prepared a literature review that outlined better practices for promoting positive mental health in the school setting with an emphasis on the adolescent age group using the comprehensive school health model. Based on findings from my literature review, I created an infographic using a program referred to as PictoChart and then reformatted it into a poster for the school district. I have provided a picture of the infographic later in the presentation in case you're curious. From my literature review, it was found that in BC, approximately 1 in 7 young people will experience a problem with their mental health. I can't emphasize this enough, but this makes mental health a very significant health issue. By emphasizing adolescent mental health in my review, it was discovered that during adolescence, the brain undergoes a significant period of growth and development, making it a very critical time for developing and sustaining positive mental health. According to Strauss, the adolescent is at the mercy of powerful physiological changes as well as facing psychosocial developmental challenges, which may include forming an identity, becoming more independent, and establishing peer group relationships. This diagram presents key concepts associated with positive mental health. Oh, I'm glad you can see that okay. To name a few, we have diversity, connectedness, resiliency, and strength-based perspectives as examples. Literature suggests that practices and approaches that focus on these key concepts have been correlated with several mental health benefits, which may include effective management of emotions, enhanced problem-solving skills, increased participation in school activities, among many others. In my literature review, I highlighted the evolution of health promotion in schools. As you can see from the diagram, there has been a major shift in practice from an individual behavioral approach toward a more holistic, comprehensive approach to address health issues. Principles from the 1986 Ottawa Charter for Health Promotion are fundamental to this shift in practice. It has made us realize that health, especially mental health, is a complex matter, influenced by several interlinked factors. If it is not addressed using a more comprehensive approach, you can clearly see it will not have as great of an impact on student health. Now on to comprehensive school health. This diagram illustrates the comprehensive school health approach. It is comprised of 4 interrelated pillars that include the social and physical environment, teaching and learning, partnerships and services, and healthy school policies. Comprehensive school health presents a better practice framework for addressing school health areas, including mental health, because it supports that physically and emotionally healthy children and youth learn better, and that healthy lifestyle choices are a contributing factor. It recognizes the importance of the school setting in promoting mental health, and it integrates health into all aspects of school and learning, among others. The next few slides will provide a basic overview of better practices for promoting mental health based on comprehensive school health's 4 pillars. Bear with me a little bit because they are a little bit dry. So, The social and physical environment is defined as the quality of relationships, emotional well-being, and the physical spaces in schools, such as buildings, equipment, and outdoor areas. Better practices for promoting positive mental health include having a welcoming, student-centered environment that showcases achievement and unity, provides easy access to school facilities, and allows for student participation in planned learning activities. The second pillar, teaching and learning, is about providing opportunities both inside and outside the classroom, thank you, both inside and outside the classroom to help children and youth build knowledge and skills that contribute to their social and emotional growth. Better practices may include incorporating culturally relevant themes into instruction that allows students to gain a deeper understanding of diversity, provides opportunities to practice social skills, accommodates different learning needs, and supports individual autonomy. The third pillar, partnerships and services, highlights strong connections between the school, students' families, and members of the wider community. Better practices include interaction and collaboration with families, as well as community and government organizations. And the last pillar, healthy school policy, encompasses the rules, procedures, and codes of conduct that are foundational to help shape a safe school environment that promotes student health and well-being. Better practices include having policies that contribute to the emotional and physical safety of students, that are accountable for everyone to model respectful behavior, that are accommodating for learning and social needs, and that allow for school connectedness and restoration. Now that I defined and discussed comprehensive school health, the BC Healthy Schools website provides several stories that demonstrate the approach in action. As an example, one school noticed that behavioral issues increased when the junior high was reconfigured to a middle school and realized that a potential factor was likely due to not having age-appropriate outdoor facilities. To address the issue, the school involved students, families, principals, and school staff in their decisions and created a space that accommodating learning needs, allowed for a healthy interaction, and contributed to essential components of health and well-being, such as the emotional, physical, spiritual, and mental aspects. Perseverance and dedication to the project resulted in a reduction of children with behavioral issues to the office. In my practicum, I saw myself as a resource by providing schools with a better practice approach to address a significant health issue. The infographic and poster created for the district will hopefully encourage schools to view how they are addressing mental health issues. For example, if practices are effective, are there ways to build on the successes of those practices, or what are some ways to improve the current practices so that they are more effective? I also saw myself as a leader or champion, which is an essential aspect of implementing a comprehensive school health framework. However, one person can certainly not act alone. A team of committed individuals is necessary for changes in the school to occur. So these are 4 slides from my infographic, and the images illustrate basically how a complex idea can be presented to a wide audience in a simple way. And if you are curious, this is public on the PictoChart website. You could just Google my name or the title, Promoting Positive Mental Health, and you should come across it. These are some strengths and challenges experienced in my practicum. I knew you'd like that, ladies. A couple of the strengths include compatible stakeholder interests for student health, as well as collaboration between public health and education. Some challenges include power and status differences and their influence in certain projects, as well as having a different meaning for mental health, speaking specifically to discipline-specific languages and lenses. I also want to highlight the challenge of keeping all key stakeholders in the loop, as you don't want to resemble Chris Hemsworth and Thor and wonder, what's going on? This diagram emphasizes the importance of health and education working together. Healthy students are better learners, and better educated students are healthier. To achieve better mental health outcomes, different sectors must abandon their individual agendas in favor of a more collective approach, as no single organization can solve this complex problem. Although this feedback loop speaks to the importance of health and education sectors, it is important to recognize the community as part of that partnership, because ultimately, everyone working together will have a greater impact. And finally, it is important to remember there is no health without mental health. Thank you.
Betty's very pleased. That was perfect time. Questions for Maria?
Yeah, great job. I was just going to ask you, who is the iconographic meant for? If you could just speak a little bit more about that and how it's going to be used. And
Yeah, so the infographic is public for anyone to view, actually. I'm not really too sure if it was done, but the infographic was actually, a link to it was posted on the Greater Victoria School District website, so it is accessible for schools, families, students, and basically anyone in the wider community, because it is using appropriate language for a wide audience, and that was its intent originally.
Other questions? No, I think Victoria, you're up.
And Victoria.
I become the default when there's no other questions. Maria, really well done. Beautiful presentation.
Thank you.
Can you just reflect a little bit about the connections between the two different sectors? Because your practicum is unique because you were doing a practicum within the school district, outside of what we would consider a traditional public health setting. And so can you reflect a little bit about your experience doing this project within a different sector and those relationships?
Yes, the partnerships, especially between public health and education, was definitely a predominant experience within my practicum, and I found it just extremely enlightening, to say the least, because I felt like I wasn't completely disassociated from public health. I was still able to use my public health knowledge in a different setting, like you said, a non-traditional setting, and it was very open. I was actually very impressed about, I was very impressed at the aspect that a lot of people do have sort of how can I say it? A public health lens, in a sense. It's not really necessarily just an education lens. They are incorporating the wider community, upstream approaches to promote health within the school setting. So I was very pleasantly surprised, and so I think that energy really fed off of each other within the practicum. So it was a really great experience.
Okay. Final go round for questions? If not, then thank you so much, Maria. It was excellent.